Welcome to this evening's town hall on mental health resources in the lower Russian River and western Sonoma County. Thank you so much for joining us tonight, and apologies for the delay. We've just been working out some technical challenges. It is our first ever hybrid Zoom town hall where we are both in person at the Monte Community Center as well as streaming on Zoom and Facebook as well. So thank you so much. I want to start by acknowledging that we are in a mental health crisis, not just here in Sonoma County, not just in California, but really across the United States of America. We are seeing organizations across the United States have challenges recruiting and retaining mental health employees to meet the demand that we are seeing in members of the public right now. And we have unfortunately had a number of fatalities in the lower Russian River over the past couple of years that are directly the result of mental health. And so we think it's really important to come together in community to really educate folks about what resources are available, and not just for you, for your friends, for your family. It's critical that we destigmatize some of the, sort of just tired tropes, quite frankly, that we have around mental health, and really empower folks to address their concerns and their needs and get their mental health and turn it into mental wellness. So with that, I'm going to introduce a fantastic panel that we have today, not only our county resources with the Department of Health Services, but also our fantastic partners at West County Health Centers, West County Community Services, and also we have a representative from the 5th District for our Mental Health Board. So with that, I'm going to introduce Dr. Jan, or the Behavioral Health Division Director, to lead us in a mindfulness activity. And thank you so much, Dr. Jan, for being with us tonight. It's my pleasure. Would you like me to hold it while you start?
You'll have to hold it because the owl rules, right?
Yes.
So, okay. Good evening, everybody. I was asked to do a mindfulness exercise with all of you, and those of you who know me, and those of you who are going to get to know me, mindfulness is really a central part of my life. And I also feel like it's really important these days that we are in a mental health crisis. And mindfulness practice is a way for all of us to learn to press the pause button, step back, and really learn to take care of ourselves and listen. We talk about survival of the fittest, but it's really survival of the nurture. And it's really through human connection. And it's really through making connections through love, kindness, and compassion that we're going to heal. So join me in a little mindfulness. And that mindfulness, the data's out there, the research is out there. 10 minutes of this a day is extremely, extremely beneficial. So, all right. I'm going to ring a bowl. This is a Tibetan bowl. And it's just, the bowl is a reminder to all of us to press that pause button, turn your phones off, just take a break from the busy day. Mindfulness is simply paying attention and having the awareness that you're paying attention. So I invite you to join me for a few moments of mindful breathing. We're going to breathe together. We're going to place our attention on the breath. We all have it. Just bring your attention, close your eyes or lower your gaze. And be aware of the breath going in, breath going out. Breathing in, breathe out. Breathe in, breathe out. We'll take a big breath. Fill your lungs and belly up. Let it out. And then take a second breath in. Let it out. Shake it off. In, out. out, let it shake it off. Now just bring your attention to the breath, putting your attention like a butterfly in a flower. And you'll notice all of us feel the breath in a different place in our body. Some of us feel it tickling in the nose. Many of us feel it in our hearts. And some of us feel it down in our bellies. Wherever you feel that breath, bring it in, bring the breath in. And on the exhale, breathe to that place. Breathe to that point so that you can be here now. Take this one step further. We'll just do 3 simple breaths together. And breathing in and out. Listen to the sounds. Be aware of any tension you might be holding in your body. Relax your forehead. Relax your eyes. Bring a smile to your lips. And second breath in and out. Relax that neck, shoulders, arms. Be aware of all the sensations in your body. Like the body filling up like a cup of water. It's full of sensations. Last breath, breathing in. Be aware of your sits bones in the chair and the feeling of the floor. Breathe in. Very nice. Thank you, everybody. I'm going to ring the bell and we can start our meeting. Governed.
Thank you so much, Dr. Jan. I wish I could start every day like that. That was beautiful, and it's amazing the way that whole sings. So, thank you so much for sharing that with us today. With that, it is my pleasure to introduce Tina Rivera, who is our Department of Health Services Director and who is a just champion for mental health services and deeply committed to serving all of our most vulnerable residents from our urban areas to our rural areas out in West County. Tina, thank you so much for joining us this evening. Really appreciate you being here.
Thank you so much for having me here. And I brought some friends with me, so I'm not going to talk long. I've brought along Wendy Wheelwright, who is our section manager for our adult services, and also Sid McCauley, who is also a section manager and who also helps oversee our CSU, our Crisis Stabilization Unit. So I'm just going to share a bit about our 988 services and give you a little update there. And they're going to come right on up after me and then share some other activities and services that will be important for our community here. And so just a little bit of statistics to kind of segue off of what Supervisor Hopkins has shared. 1 in 5 adults experiences some form of mental illness in any given year. That's really high. We have a serious mental health problem in our community. According to recent studies by the Wellbeing Trust and the Meadows Mental Health Policy Institute, the pandemic that we are so sick of hearing about has increased those rates of clinical depression, anxiety, and suicide. And across the population, 1 in every 25 adults is living with a serious mental health condition such as schizophrenia, bipolar disorder, or long-term reoccurring major depression. And treatment for these types of conditions is often not sought due to inaccessibility to services, coverage and reimbursement barriers, or the patient's unaware that other physical symptoms could be connected to a mental health condition. And so legislation was passed with respect to 988. And one of the reasons also why legislation was passed around this very important tool that we now have access to, which is likened to our 911 system, it was because 1 in 4 people were shot and killed by law enforcement between the years 2015 and 2020. And these individuals had a mental health condition. And this is information from our U.S. Department of Justice. And so because of our current mental health crisis response system, it has relied for many, many years on law enforcement, and it has put people who have these particular conditions in precarious positions, oftentimes traumatizing them even more. So what we've come up with is what we call 988. So there's now what's available to us is a new free crisis phone number for behavioral health crisis needs. It was approved by Congress back in 2020 for use nationwide. So what that means for us here in Sonoma County is that beginning July 16th, so it's available to us now in this year, instead of dialing 911, emergency calls can now be placed to 988 for urgent help in times of mental health needs or crisis, substance use crisis, or even if you are witnessing such a crisis, you can call 988 if you see someone experiencing a behavioral health challenge. The Federal Substance Abuse and Mental Health Services Administration, or what we like to call, we like our acronyms in government, SAMHSA, envisions that this is a good step towards providing some sort of transformed national crisis care system, that we can reform our system here nationwide. And this is us taking a step towards that. So this is meant to be a universal entry point to crisis care that individuals can access a trained crisis care counselor. So staff would be answering this 988 line. And you say, well, what staff? Would it be our staff at the Department of Health Services? Who are these staff? Well, they would be Buckaloo programs. They're based in Novato. So it sounds a little strange that you'd be calling 988 and you'd be getting Buckaloo programs who are based not here in Sonoma County, but they're manned. Buckaloo staff would be manning these lines. They would be answering those phone lines for our particular area. They're operating the Suicide Prevention Lifeline. They'll receive our area 988 calls. They'll evaluate the emergency or the situation that's called in. They have trained crisis care counselors who will be on hand. If it's an emergent situation, for instance, that requires an urgent physical presence, they'll call in the mobile support team that's connected with Moreno. If it's someone who needs to be on site physically here in our area, then they will connect them with someone here in our mobile support team. So that's just some basic information about our 988 line. We have brought some flyers with us in English and in Spanish. We have some cards, etc. So please pick up some information to take along with you for more information on the 988 line. So at this time, Sid, Wendy, come on up, and they're going to begin to explain some other additional services and supports that are available here and give you some additional information.
Thank you, Tina. My name is Wendy Wilred. I'm the Adult Services Section Manager for Sonoma County Behavioral Health. This is my colleague, Sid McCauley.
I'm the acute and forensic section manager for Sonoma County Behavioral Health.
And we'd just like to talk to you briefly about the compounding events in our community that have led us up to this mental health crisis that we're in right now, and talk about some tips and tricks on wellness that could be helpful, and as well as some local resources. So if you would go to the next slide. Thank you. So if we go back down memory lane just a little bit to 2017, you might recall the Sonoma complex fires that forever changed our community and how we respond as a community in times of disaster. But what is sometimes missed and forgotten is all the things that came after. In 2019, this area, the Russian River area, experienced, whoops, you can put it back, the sixth highest flood on record. And over 2,000 homes were affected by that. And then subsequent to that, we had in the same year, the Kincaid fire up in North County, which caused an evacuation of almost 75% of our total county, including all of West County. And then in 2020, we had a global pandemic that showed up and is still with us, that has caused ongoing concerns in terms of impact on health, emotional wellness, social connection, our educational system, and our workforce. And then again, in 2020, while we were dealing with that, you may recall there were two fires that year. One out here in this area, Walbridge and Myers, which affected 57,000 acres, as well as the blast fire later that year. This is a lot to go through as a community in a short succession. And as a community, while we grieve and try to recover, we don't quite complete that process before we're dealing with the next thing. And so this is what's known as compounding trauma, and it has an impact. But there is some good news that I want us to focus on. Would you go to the next slide? Connection is the most powerful tool we have in our toolkits to help stave off the long-term impacts of trauma. And West County is very good at connection. West County is a special place that has a special connection to nature. It has a special connection to being welcoming towards people of very different backgrounds. And so you have a tool in your tool belt that is the most protective factor that we have available to us in this process. But it's not just any kind of connection. Go to the next slide. Let's talk about that a little bit and just click once. There are people that are in my world because I owe them money and they owe me money. This is not the right level of connection to be nurturing to my soul, but it is probably the most common type that I have. To do the next click. Within that is my sense of community. These are groups that I feel like I belong to, my neighborhood, my workplace, my church, perhaps. We have a sense of community where I feel like I belong to that group. I should go to the next one. Now, this group I called conditional. These are people that I love, but they have a tendency to only call when they have a problem. Anybody? Now, you don't have to admit out loud, but if you start referring to your friendship group as your caseload, maybe have a few too many. In this one, you know what I'm talking about. I have some blood family in there, I'm not gonna lie, but I love them. I just have to acknowledge that it's a little bit one way. Would you give me one more click, please? This is my inner circle. These are the people that love me back in that same way that I know would walk through the night for me. This is a smaller group of people. And your homework for everyone here and those listening, I want you to think about who is in your inner circle and call them and tell them they made the short list. Okay? And make a plan to connect with them. This is the kind of connection that sustains us through these things that we have gone through. Keep us that one. The other thing that's important to remember is that we have things we already do that work. And we have a tendency to forget to do them when times get rough. So this is me reminding you of stuff you already know. You already have these skills. Think about it. Eating well, moving daily, hydrating often, sleeping a little more, love, laugh, and connect. And I don't mean this to be an exercising guilt. If you're looking at that and going, oh, wow, I forgot to eat breakfast, I skipped my workout, I haven't had any water today, I stopped sleeping 20 years ago. But you did laugh at my jokes, and you got 1 out of 5. So hey, the idea is pick one to do more, and your body will thank you and go, oh yeah, I like this. This works. It turns out it's quite simple to do self-care, and yet it's hard. So, what's on the next? We would like to talk about some local resources here in our community that can help in times of mental health need and crisis. So I'm going to turn the mic over to Sid briefly to talk about that. Give us our next.
Thanks, Wendy. So, okay, sorry, haven't seen the slides yet. So Tina talked about 988 and how it is local people answering the phone who are aware of the local resources, and that's really important. And just to let you all know who are here in person, we do have a 988 flyer here and 988 cards. And another really important thing to know is that you can, it isn't just that you can call 988. For those of us who are a little phone shy, you can also text 988. And so, so for a certain generation, that might be really helpful. Or maybe all of us now, I don't know.
Can I ask a quick question on Facebook? Someone was asking if you could confirm, are the 988 staff licensed mental health practitioners?
You know what, I actually do not know the answer to that offhand. They're trained crisis call workers
Supervised by a license.
and supervised by a licensed person.
Thanks.
All right, so I think I need to both look at this and be in the camera. Okay, so so the mobile support team, as you can see, covers much of Sonoma County. It does not yet cover all of Sonoma County, but it does cover West County. And in fact, we were looking at the data earlier today, and there have been a number of calls out to West County just this month. And and as we, you know, and right now the hours are, thank you, 12:30 to 9:30, Monday through Friday. We are working very hard on expanding that. The staff shortage that was referenced earlier is the only thing getting in our way. So we're trying very hard to recruit people to expand our hours. So we're covering weekends and eventually up to 24 hours. The other piece of that is I just completely lost track of what I was saying. So you do still reach the mobile support team by calling 911. And that is very intimidating to people. And that is another thing that we're working on, is having a model where the mobile support team can go out without law enforcement. For right now, though, it still is a law enforcement response. However, calling 911, talking to dispatch, talking about that it is a mental health crisis and a mobile support team response would be really helpful. We also have here up on the table and on our website guidelines for effective communication with 911 dispatch, which is a really helpful resource, so that to help you communicate the things that law enforcement needs to hear to know what kind of response to have. And so so I encourage everyone to take a look at that if they do have a loved one who's in crisis, and look at it in advance, so that call to 911 isn't so fraught. We also happen to have the behavioral health division brochure up here to talk about all of our services.
Now I'm going to talk about one in particular because we're on this one. So we have a community mental health center up here in Gerville. And the community mental health center specializes in providing outreach engagement and outpatient, especially mental health services to folks in the community, or specifically in West County, who are experiencing a severe or persistent mental illness. And so in addition to helping people like geographically isolated, they also are able to do some outreach and help folks that are experiencing homelessness or co-occurring substance use disorders with mental health conditions. They are linked to our larger adult system of care that's centered in Santa Rosa, but they are based out here so that they can be more available and closer to the community that they are serving. If someone wanted to assess for services, our main access line is here on the slide. That's 707-565-6900. And that's our starting point for anyone who wants to be assessed for services within our system of care. And if then they would work way out here, then they would be picked up by this team that's like that. And that is what we have to share today. Thank you so much for.
Can I ask a question? Is that?
I want to do it now. Yeah, let's go for it.
Thank you.
Yeah, right here. I'll bring you the microphone so that you can see.
Hi, thanks for the presentation. So I'm concerned about the teens. You know, everyone needs mental health support, but especially in West County, our living high school students who are in Forestville now. And I didn't see Forestville listed up there as one of the service areas. So I'm just wondering how the high school kids can get some support, because there's been a lot of issues there.
Great question. We will have a focus on youth coming up as well with a future presenter, but I don't know if anyone wants to jump in now and share a few words on that.
Just real quickly, we haven't forgotten the school, the high school. We have been working with the school districts to and actually have designed a school program that will begin in the middle and high schools. We will be bringing that to the board. We've brought it through to our Measure O ad hoc, which is the tax revenue bill that was passed. So we're going to be bringing that to the board here within the next few weeks for review and approval. And it will touch Forestville and many of the high schools. It's a scalable program. So we'll be bringing those mental health services to the schools.
And I think Dr. Jan had something to add.
Can I just say one more thing about it? So that the number for access that Wendy had up on the slide, if you have a teen or a young child and you're concerned about that child, you can call access, talk to somebody to see if it would be, if they really need to come in and have an intake and be interviewed and evaluated. So the access line, that's another way to get into our system and get services.
And the mobile support team does cover Forestville.
Yeah, definitely.
And then lastly, we are piloting, our youth and family services section is now co-locating staff in some of our community mental centers. So we actually do have some youth and family staff that are spending hours out in our clinic right now.
Thank you so much. You know, I have to say truly that the best part of my job is being able to work with some absolutely fantastic human beings, and the entire team at Department of Health Services is wonderful and deeply dedicated to mental health services and serving the public. So thank you so much for everything that you do. Now it is my pleasure to introduce another of my favorite human beings, which is Kathy Smith, who is our West County representative, one of our West County representatives for the Sonoma County Mental Health Board. So I'm going to hand it over to her to share a little bit about the work of our local community-based mental health board.
So Linda gets to appoint 3 people to the County Mental Health Board, and I'm the person at this point. There's another, Sarah is coming on, and so we do have openings for people on the Mental Health Board. And we would welcome having people apply. The Mental Health Board is an advisory board, and we advise Linda, and we also work very closely with the behavioral health department. And one of the things that I've been on the board for quite a while. And one of the things that I have found is that the mental health board provides an excellent opportunity on a monthly basis for people to, if they attend the mental health board meetings, they learn a lot about what is happening within the behavioral health system at the moment. Jan reports, and often Wendy and Sid also report. And so you get a really good eye on what is happening and what is new and all of that. I want to mention that one of the things I've been on the mental health board long enough that I was there before the Mental Health Services Act was passed, and the mental health system has become so much more responsive to family members and people with lived mental health experience since that. So I'm going to real quickly say that there are 3 types of board members that we are looking for: family members, people who have family with lived mental health experience; peers, people who have lived experience themselves; and general community members. And at this point, any one of those categories would be welcome on the board. You can see what has happened at the board meetings in the past by going to the county website, to the Sonoma County Mental Health Board. If you type that in, it'll take you right to the website, and you can see the minutes from past meetings. And most of them have been recorded, so you can see the recordings. If there were special presentations, you can actually see those presentations. If you are interested as a District 5 person, contact Linda's office and she will direct you on how to get your application submitted. Thank you.
And Kathy, I'm going to ask you to stay up here for just one moment, because I wanted to share some information with you, which is that on November 8th, the Board of Supervisors will actually be passing a gold resolution in your honor, thanking you for 22 years of service on the mental health board. When we last shared, and we actually have a language preview to share with you today that you can take home with you. But I think the word that jumps out most when I sort of read this gold resolution over to myself is altruistic. You are tirelessly dedicated to your community, and it is that altruism that honestly has inspired me. And you know, one of the things that I remember having early meetings with you and fighting so hard to get the mobile support team out to Western Sonoma County, because it previously used to stop service at Windsor and didn't go west really of the 101 corridor. And so, you know, hearing from you, your stories of your lived experience and how we can make a difference, I really believe that you have championed and you have made a huge difference in mental health services in Western Sonoma County. So thank you, Kathy.
You too.
Thank you, Kathy. And here is the preview of the language that I will be voting on in November. So thank you. And with that, it is now my pleasure to introduce Dr. Jason Cunningham, who is the CEO of West County Health Centers, and also to congratulate Dr. Cunningham on the opening of a world-class facility located just up the road here from Monterey in Guerneville. So congratulations on bringing that dream to reality of a world-class, care facility for our Lower Russian River residents. And thank you for your leadership, and look forward to hearing more.
Thank you very much, Linda. I'm super excited about that building, which we'll talk about a little bit more. And it came about through many wonderful people doing good work. I am supposed to be joined by Erin, who's our youth services director. Those of you who know Erin know that I'm not going to do service to her work. She has an incredible passion for youth and young people. I'm going to do my best to talk about that and to really address your issue. So I'm a family physician. I'm the CEO at West County Health Centers. For those of you who are not familiar with our work, We've been here for almost 50 years, over 50 years in Guerneville and Occidental, and in Sebastopol and in Forestville. And I have a passion for our community. And I've been here for 20 years. And I have to say, the people, and that's an inspiring story of 22 years of deep work. And that's what inspires me here. It is compelling the West County asset of people who are deeply passionate and are able to invest in neighbors with unconditional love. So I'm inspired by that. What I wanted to touch on is West County Health Centers thinks about our emotional and our mental and our wellness from the lens of the whole person. We get to participate in that in family medicine and in primary care. So we look at it through the lens of all of healthcare. Most of what we deal with outcomes has to do with our behaviors and our behavioral health. And so we've invested in services within our primary care space that include licensed clinical social workers, PhD psychologists, marriage and family counselors, psychiatrists, psychiatric nurse practitioners, and care coordinators, because we think that's part of medical care. And we also think that although we are in a mental health crisis, it really requires us to go farther and farther upstream, which means to me that we need to invest in our understanding of emotional health and our mental health as a normal part of our living and our life. It's in the context of our community. It's in the context of what we do every day, how we manage that, how we mitigate that. And so to be part of a community and community work is where our passion lies. So West County Health Center serves 13,000 patients, and our services are for patients who are our existing West County patients, except in our schools, which we'll talk about. That includes cognitive behavioral therapy, EMDR, wellness groups. We've got a large amount of work with mindfulness. I was really thankful that you presented that, which is all about how we manage our own health. How do we as individuals work through that? So if you're a patient of ours, you can have groups that are led by licensed therapists or by peers to do any number of those services. We also have services both virtually and in person for one-on-one therapy and for group therapy. We think of addiction and substance use as part of chronic illness and are normalizing that, trying to reduce the stigma around that. And most of us in primary care now are ex-licensed for opiate use disorder for treatment with Suboxone, and passionate about that. And interested in normalizing that. So working also with alcohol use disorder. I don't think everybody recognizes that that is much more treatable now, both from therapy and also medication-assisted treatment, tobacco use disorder, stimulant use disorder. Those are all things we really need to normalize and reduce stigma around. And so that connection between mental health, physical health, and substance use is something that we want to integrate. And then really recognizing that the mental health and emotional health is in the context of our culture and our community and our families. And so the concept of bringing people into a medical provider, even we have a fantastic new facility, the thought of them having to come into a 20-minute office visit or an hour office visit physically doesn't make sense. We need to be going out to them. And so really working on place-based services, community-based services, working with others to do good work. And so transitioning into that, I would say that we are trying to meet the needs of our most vulnerable population. So our mission as a community health center is that anybody who walks the door gets treated, no matter if you have ability to pay or not. And we tend to serve the most vulnerable patients who may not be served elsewhere. And so our teen clinic came about when some school nurses were seeing an uptake in suicidality among our young people. And we started our teen program. That's driving sense. We have a large unhoused population in the West County, and so we have a homeless services access point. And for that population, we have community health workers, case managers, psychiatric services, psychiatric case management, and really working with patients who have a lot of comorbid mental illness and substance use. So really focusing on that population. And then going to the schools, and I'm going to pivot to try to be Erin here, deeply passionate about schools and young people in the context of families. And so one of the benefits of the pandemic is recognizing that we can get outside of the four walls and get paid for it. And in order to do that, that's our sustainability. We don't need to get a grant. We don't need to draw down. We can actually go into the school unit and do that. And so we've worked with the Guerneville School, Dana Pedersen, who's a strong advocate for collaborative work, and then at Anley High School and Laguna High, we have direct services there now. And that is in the context of passionate educators and passionate leaders. So the Unified School District also very interested in figuring out how we bring more resources to the kids where the kids live and kids operate. For us, that means we have peer educators in all those schools. So addiction and overdose has been a real uptake, and suicidality is a big uptake in that population, particularly in the Laguna High population. And so working with harm reduction. What is harm reduction? Normalizing, reducing stigma. What does it mean to have the ability to do first aid with Narcan? What does it look like for fentanyl test strips? I've got teenagers scared to death that they're going to go try something and then not have a second chance. And so all my kids have Narcan in their glove box, in their car. So we need to normalize that in the population. And then working with schools to understand, how do we understand and identify those who are at risk and figure out how to invest in not just cognitive behavioral therapy or not just mental treatment, but understanding how do we do that on a regular day-to-day? How do we do mindfulness? How do we understand kind of reducing risk? There's a huge gap in the kid who is having dysthymia or having low-level depression to the kid who is suicidal and not able to transition out of this, or has been traumatized by us saying you need to be seen in the more significant care, which is not a normal space for kids to be. And so we have now mental health practitioners, licensed clinicians in the schools themselves to try to add that level of support. And the county is also supporting that. I know there's a big investment in that in the West County, so really appreciate the collaboration. We need to be able to then connect people. And so we have liaisons who are just, all they're doing is connecting either to the Kaiser system or connecting to their primary care system or connecting people into mental health. And that's an important place that we feel like the schools just aren't equipped to do that. And so we need to kind of partner to do that. We need more crisis support in the schools. And so we're working in the grants around the community school project and other work, but there's a long way to go on that. So just to say, we hear what you're saying, and we're invested in moving upstream in that direction. Then I'll end by saying the kid is connected to family. So COVID, we're in our homes, we're stressed because of our financial situation. We're stressed because of what's happening in the world. We use substances to mitigate that. The trauma that our kids are experiencing because of our family units that's stressful is intergenerational transfer trauma. So we really need to be going upstream to understand how do we support our families and what that looks like, and destigmatize mental illness, destigmatize substance use, figure out how to do that. So we're quite interested in partnering. We're going to have some great presenters from both West County Community Services and our Senior Center. What does peer support look like? What does that look like for us to support parents in this work? And then we're pivoting towards more work with our seniors. The isolation in our senior work is another big area of support. So all I would say is we're interested in partnering. We would say that West County Community Service, West County Health Centers is trying to be good at what we do, but we shouldn't be good at all things. And for us to think that all that comes into the health center is not where we need to be thriving. So we'd like to partner with others, partner with other community organizations and do that together. And then lastly, we have our new building at the Russian River Health Center, right next to Safeway there. And one of the buildings is called the Resiliency Center. The vision of that building is that it's a space for meeting. And we know that when we do collaborative collective action, it's hard to do it without a place to meet. And so we would welcome those of you who want to meet in that space, either during office hours or after office hours. That's a space similar to this, that we would rather have too many people coming through there and figuring that out. So Leo, I wonder if you could put that, my email in your chat, be able to say, please contact me if you're interested in bringing a group to that space in the lower Russian River area, just to meet and do good work together. So thank you so much.
Thank you so much, Dr. Cunningham. And I hope that one of the things that what everyone took away from that presentation is that we really need to focus on all generations and all ages. there is sort of not a generation or an age that is currently alive on this planet that does not struggle with the impacts of mental health, including when you look at very young children who are subject to adverse childhood experiences that ultimately contribute to mental health challenges when they're older. So I think that's a perfect transition to welcome a representative from the Sebastopol Senior Center, Scott King. And for those of you who are not aware, the Sebastopol Senior Center actually was Uber before Uber existed and was cool. And so one of the critical resources that actually affords seniors the opportunity to go get to medical appointments, to go get to mental health services. So thank you so much for your work at the Sebastopol Senior Center, and hand it over to you to share more.
Thank you so much. Before I tell you lots of great things about the senior center,
Did you come over this way?
over here, okay.
We got the owl,
Thank you. You're all doing such great work. And it's really important to me to put a face on it that my son Spencer, he passed in August, of fentanyl. He just wanted to relax. And it's good to acknowledge all that you're doing, but also it's hard, I think, especially for young males, because the economy, I don't know if you realize cars cost double now, tires cost double, gas costs double. And he just wanted to have a girlfriend, had a nice car and a job and a positive look forward, which I think is tougher now. And you talk about fixing things upstream, that's so important. I'm just discouraged right now. How do we fix politics and the economy and things in the country? It's really difficult. But anyway, I told Spencer I was going to continue on. His spirit came to me and said, take care of my dog, which I am. And I get to be of service in my job and help people. And he's appreciating that I'm going to live. I'm 65, but I'm still alive, so I feel like I get a do-over. So anyway, on to the senior center. We're working on our name. Senior has become pejorative. It's amazing. So first of all, we're not a convalescent home. We're not pushing people around in wheelchairs to slump over their tray of food or anything like that. It's more of a community center. We have Tai Chi classes. We're serving lunch now, which was really important to us to bring seniors out of isolation. They can come in, sit at a group table, meet people. It's a reduced price. It's subsidized for a 4-course meal, Monday through Friday. You should all come. It's from 11 to 1. What I do is we have a program that's been going for 14 years. As you mentioned, we take seniors to their doctor's appointments and we bring people to your centers. And if you live out in West County and you don't drive anymore, wow. As you know, it's hard to get a taxi, a bus, transportation is difficult. I have a team of 38 volunteers that are retired, that love driving, and they donate their own gas, their own time. We've tried to reimburse them for mileage, and they're like, no, we don't want to take money from the senior center. But a lady called, she needed a ride because she drives a clutch, and she'd broken her leg, and she was 82. And I said, ma'am, I'm not finding you in our database. She goes, I'm not a senior. So we're looking at rebranding to be the fun center or the center for thriving or something. And you know, all these words, education, which we do exercise, we're doing meals, we're like a cross between a library and a restaurant, a gym and everything. So we have a team of people working on that. So we've been going 53 years. We give away free equipment, you know, and people donate us wheelchairs and walkers and those things you put ice in when you have shoulder surgery. And there's even an oxygen tank down there and shower chairs. And anyway, we just hand them out. So if anybody needs that, everything we do really is for mental health, from the exercise. We have a balance class, you know, when you're a senior, you don't want to fall over. That's like the worst thing ever. And I'm sure Dr. Cunningham would agree. And so those classes are filled up. Volunteering, really good for mental health. The people that drive these seniors to the doctors, they tell me they feel so good. When you get in a car with somebody, it's more than just passing by, or you actually get to talk. And some of these 80-year-olds really tell stories about their life. I mean, it's amazing. We have 95-year-olds that just gave up their license. And So the cafe, we have a men's group, a women's group, and an LGBT. I'm the LGBT liaison. We have a dance coming up. You're all invited for our Halloween dance, October 29th. It's gonna be a lot of fun at the senior center. And I have a once a month mixer for LGBT as well, because it's great to feel like your family and you can talk about your same-sex partner, your daughter that's coming out. I wrote an article why you're lucky if you have a transgender grandchild. Because this grandmother came and says, my daughter's transgendering, what do I do? And it's so cute because that's not a word, but I think it should be. And I helped her sign up for the class that some great group of people, the LGBT Connection, were teaching on. I even get confused about all the different categories of gender, but it's something that when you have someone in your family, it's good to learn, respect them, use the right pronouns. We have talks, cannabis, using that for pain. Dr. Bernstein, who's one of the local, talks about how can we delay mental decline, right? Don't we all want that? Let's just delay that mental decline, procrastinate that way out as far as you can. And it's about seeing people, talking, being present. And we are working on more multi-generational things. We do have a high schooler that comes and teaches seniors how to use their cell phone. That just seems really ideal, right? Most of my seniors, like, they don't text, and I'm always super excited when they have an email and I can text them when we got them a ride. So I have a lot of handouts on the table. We do need more drivers. If anybody wants to volunteer, you can work once a week, once a month, whatever works for you. It really keeps the integrity of our community when you can get people to the doctor's office. If they can go, otherwise, they might end up in a sniff or something that's really not appropriate just because they don't drive anymore. So that's one really great thing about our program. So, any questions? Yes.
You have to be a Sebastopol resident or a West County resident?
Not at all. That's a great question. People come from Roanoke Park because they say we're the friendliest.
Yeah.
They come from Santa Rosa. And we're trying to do the hybrid. What you guys are doing here is so difficult. So thank you for trying it, because we put all the classes on Zoom during the pandemic, and now people want to come back, but some people, wow, the parking is difficult. I want to do my Tai Chi from home. So we're working on doing both. So I applaud what you're doing. I think this is the future. And this is, you're just doing a great job right here on that. And yes.
So what is your, do you have a cooperative relationship with the senior center up here in Gurnville?
We love them. Emily and the Gurnville Senior Center, we share the transportation program now. Theirs is actually shutting down, unfortunately. So we're taking over all of the river area. That's why I love a few more drivers. You know, when you drive from Sebastopol to pick up somebody in Gurnville and drive them to 500 Doyle Park Drive, I mean, it could be 100 miles. So, you know, they have a van. There's got to be some creative way we can get more people to their doctor's appointments. So I'm putting my thinking cap on for that. Did that answer your question? All right, thank you so much.
Thank you so much, Scott, and thank you also for sharing the spirit of your son, Spencer. I really appreciate that. And you know, I would just challenge everyone listening tonight to think about the challenges that you have faced, or that your family members or that your friends have faced. Because I don't think that there is a person that in Sonoma County right now who has not been touched in some way by mental health challenges. And, you know, and that is why it is so important. Again, I'm going to say this one more time, to destigmatize this, to talk about it, to make sure that someone who is maybe hiding it from you stops hiding it from you. And then you can tell them, hey, you can call 988. Hey, I know that there's a peer support you know, program. There are resources for teens. There are resources for seniors, because that's the way that our community moves through this and it's stronger. So thank you very much for reminding that. It was a really important reminder this evening. And with that, I'm going to be introducing Michael Reynolds, speaking of peer support with the Russian River Empowerment Center. Thank you so much for joining us this evening, and thank you for the wonderful work of West County Community Services.
Thank you, Supervisor Hopkins. And I actually am going to be representing four different programs, because Emily and Melissa, who run our senior center and the senior peer counseling program, are not able to be here. So, really appreciate this collaboration opportunity to come together, see so many friends and partners, and to make some new connections and continue to talk about ways that we can work together to strengthen and widen the network of support for our community. And so I will start off talking about the Russian River Senior Center. Thank you, Scott, for mentioning the collaboration that happens there. And our center is open to anyone who is 60 years or older. It sounds like it's very similar to the Sebastopol Senior Center. Sometimes think of it as a hive because it never stops buzzing there. When the doors are open, there's always a crowd. There's always, I've been there as early as 7:30 in the morning, and there's some guys down in the coffee, sitting out on the deck chatting. They have Zumba classes. They have bingo. They have lots of educational classes. They do serve meals 4 days a week as well. And they take day trips. I can't wait till I turn 60 so I can take some trips to the city with them and then go see plays and different things down in the city. And also, so you know, the building is available for rental, and it's not being used. It's often rented at night for events and things like that. So that's available as well. They have a case manager that works there, Jeff Bucket. He will help work with seniors to plan and navigate on different options, connect to community resources, work with them one-on-one to help with mental health needs and coming up with new healthy ideas and depression reduction. They also work on getting meals delivered to home for those who are not able to come and partake at the center. And maintaining that regular connection. This was something when you talked about this connection and building relationships. It really is. I was on a panel hosted by Dr. Cobaleda-Keglar, the suicide prevention panel, and the message I wanted to get across is that love and relationships is suicide prevention. It's the number one thing that we need to do is make connections and continue those connections, even passing by and looking someone in the eye and saying hello on the street. It's amazing how biologically we get a serotonin kick from that, and so it really is an antidepressant to have acts of kindness and make connections with others. So just want to highlight that, and that is one of the things that happens day in and day out at the senior center. The folks come and are able to connect with each other, connect with the case manager, and get connected to the community as well. The transportation program that Scott referenced it was a 3-year program. It is sunsetting at the end of this month, unfortunately. As you can see there, 5,000 trips in 3 years. I did the math, and 5 days a week, that's over 6 people a day that are taken and transported. And those are 6 people a day that are now going to be left without transportation to appointments and things that are important for them. So it is a huge loss to the community, and we do hope that we're able to find a solution for that. We really appreciate the Sebastopol Senior Center stepping forward and taking on some of that, and we look forward to working to find more solutions to support one another and support the community. Senior peer counseling. This is a separate program that it's been in existence since 2002. It is currently funded through MHSA funding. So this is a peer program in the sense that it's seniors with seniors, and they receive extensive training to work with those who are struggling with mental health challenges and or other issues of aging. They all receive in-depth training. They are recruited and trained and supervised by a licensed clinician. And there's also, it's very short-term goal focused. So there are 12 free sessions for anyone that's interested in this. Working on developing healthier emotional balance, getting some coping skills, and getting them connected to other resources in the community as well. We do, if at all possible, meet with the senior in their home, because that's a comfortable place to do that. If for whatever reason they're not comfortable with that, then we will meet on Zoom as well. They do also offer support groups for senior women. There's one in Sebastopol where there is a consistent wait list because it's a very active community. and one in Santa Rosa, and then also Zoom for those in other areas of the county. Melissa did want me to mention that they have tried to have it for men, and for whatever reason, it just has not worked out. They just don't want to get together as much, and so we're open to that if there is interest. And then the Russian River Empowerment Center. So this switching gears completely from seniors to purely peer services. So the Russian River Empowerment Center is a peer-run support center. So a peer, for those of you who don't know, means a lot of different things in different contexts. So in this context, and it's anyone who has lived experience with a mental or behavioral health challenge. And so everyone who works at the Empowerment Center, including managers, they all identify with lived experience with mental health and behavioral health challenges. And so they've all gone through extensive training. We have a peer support specialist training class. It's 14 weeks long. It's 3 days a week, 2 hours a day. It's really like 2 college courses over a semester, and covers a wide variety of topics. And all of our peer staff go through that training in order to be able to provide the level of support that's necessary. It is currently in Monterey, right around the corner over the bridge, and it's open Monday through Thursday. We have educational and support groups and resource referrals. A lot of people come there just to socialize. We hear over and over again that this is a place where the only place that they often feel comfortable in the larger community, because they can just be themselves, not have to go along or to get along or pretend. They can relax and be around others who share similar experience. We do run a shuttle from the navigation center in Guerneville twice a week out to the Empowerment Center, and it is slated, thanks to the leadership of some in this room who are working on the George's Hideaway project, to be, once that is completed, that we will be moving there and be able to work with folks who are going to be living on site there as well. The Transitions to Housing program is a brand new program. This was something that we really started developing it 3 years ago, and the genesis came from, I was the manager of the Empowerment Center when I first started with West County Community Services, and we started noticing a lot of our members would get housing, and in a matter of weeks or a matter of months, something would happen and they would cycle out. And so we started asking the question, what's going on? What's not there to help? And so we had conversations with those who were going through this cycle. We had conversations with folks who had been in housing and maintained it and been able to maintain it. We had conversations with folks at Catholic Charities and COTS and other organizations who work with folks who were unhoused. And we said, so what do you see? Where are the gaps? What do you see that's not there? Where are the areas that we can step in and help? And so we built this program from the ground up. It took about 1.5 years, 2 years to build it. Then after we had it built, we took it back out to those organizations. We took it to the community and said, okay, here's what we have. What do you think? And all the support was positive. And thanks to the leadership and support of Director Rivera and Supervisor Hopkins, we received ARPA funding and CDC funding this spring, and we launched the pilot. It's a 30-month pilot started in July. We do have participants that are in the program now, so we're starting to work with them. It's a year-long one-to-one peer support, so we will go and meet with them in their homes to help them navigate all the challenges that come with moving from the streets into housing. Putting 4 walls up around someone does not change the circumstances most often, and sometimes can actually lead to exacerbating the problem. And so we want to be there. We're there 5 days a week for the first couple of months, 1 to 2 hours a day, depending on their need, to help them navigate those challenges, go through that major life transition, get connected to resources, talk about self-care and managing the emotional highs and lows that go with that. Connection to community was a thing that we heard over and over and over again, that people who had been living on the streets for years had friends and family who were living on the streets with them. Now they're in a home and they're like, I would rather be out there with people that I love than here by myself. And so that's one of the things that we're there consistently 5 days a week for the first couple months, then we scaled down to 3 days a week over time, but we're there for a full year to help them make that connection, to be a connection for them. And then also do things like field trips and get them out into the community to help them feel like be a larger part of the community, to be connected and rebuild that community that they're missing. I also wanted to, the point in time count just came out, so I wanted to highlight some of the things off of there that lend themselves, which we looked at when we started creating this program, and then looking at it again, saying, oh yeah, that's why we built it this way. We have life skills building classes like, landlord-tenant relationships, roommate relationships, job skills, and those sorts of things. So 40% of those in the point in time count said that they're looking for work. So 40% of the folks who are on the street said they're looking for work, and so we want to help them get connected to that. 23% of them said they lost their housing because they lost the job, and so we want to help if there are additional job skills that need to happen. We want to help them with that, help them navigate the application process, make connections in that way. 20% said they lost their housing due to a conflict of some nature with someone they were living with or or some. And so we talk about conflict resolution skills and relationship building. 37% identified with some mental health issue. So peers are essential to this now. Peers are essential to coming in and providing solutions and coming alongside and being able to speak with them and help them navigate the challenges that are so familiar to all of us who are peers. And then the last thing I would point out, which was almost the most shocking thing, but 32%. So this is the first time they've ever been homeless. 32% of people on our streets, this is the first time. Many of those people are 50 years old or older. So that speaks to something that's going on in our culture, something that's going on in our community, in our system that is breaking down rapidly. That 32% of the thousands of people that are on the street have never been homeless before, and now they are. And so we want to work with them. We want to provide connection with them, and we also want to work on upstream solutions to look at how can we work systematically to change the system and address these issues in that way. And then this just came up. This has come up a couple of times, so I want to talk to Dr. Cunningham before talking about the question about the youth program. So this transitions program was our big project for peer services for the last couple of years. Now we're transitioning. We have a new peer education training manager, she has a great heart for developing youth peer programs. We're doing a pilot right now with TLC, where we're doing a peer mentoring training program, and we want to meet with them, collaborate, and see, hey, what worked, how can we adjust this thing, and build that out so we can bring it into the schools and in the community as well to help them. So that's the question. And I have lots of flyers back there with information about all of our programs, what it means to be a peer, what peer support is, a peer education training program that I referenced, and then my business card is back there as well. So if you have questions about any of these programs or anything to do with West County, I'm happy to, West County Community Services, I'm happy to help. So thank you for putting this together and giving us the opportunity.
Thank you so much, Michael. And actually, this is how West County works. Someone could see what was happening on Facebook, but couldn't comment, so they texted me their question. So I've got a text message question and a personal question that I'd like to ask our panelists, but we'll save that to the end. And we are joined right now by Karissa Moreno from the Center for Wellbeing, who is here to give a presentation on the fantastic work that they are doing in the sphere of wellness, mental health support. Thank you so much.
Hello, everyone. Thanks for staying this evening. Nice to see some familiar faces and allowing us to present this evening. So I've got a little slideshow for you just to tell you about what we do and why we do it. And we're going to focus on our nutrition services. So just a little background about the Center for Wellbeing. We have been in the community for 27 years. We serve about 25,000 annually through our programs and services, and we are a team of 25. So we are small but mighty. We do everything from community-based programs to youth empowerment programs to specialty clinical services. So I'm going to focus on our nutrition because there's an intersectionality between health, well-being, and mental resiliency with our nutrition when those needs are being met. So next slide. So again, we have been in the community for 27 years. Our first scope of work was actually cardiac rehab. We were called the Sonoma County Cardiac Rehab Center, and then we changed our name 2 years later to the Northern California Center for Wellbeing. We really expanded our services. So nutrition was our second service that we've had, so 25 years of providing this to the community. Next. Just to give you our mission, we just recently did a strategic planning session, and we really wanted to center our mission on health equity. Previously, it was really focused on education, but we recognized that we were doing so much more than that. And really advancing health and well-being, advancing health equity in the communities that we serve is really integral to everything that we do. Next. So our nutrition services, go to the next slide. So first, just where we get referrals, we get referrals from all community clinics. One thing really interesting is that we used to just be focused in Sonoma County because all of our services were in person. But telehealth has been the silver lining of the pandemic. It's great for our patients. We've done a lot to troubleshoot those that don't have internet access or those that have poor connectivity or have low tech literacy. So we actually have a team of nutrition coordinators, Sonia being one of them, that really helps with our patients. We'll spend 45 minutes getting them online for to be able to access those telehealth services. And then we also know that there's other ways that we can meet our patients' need if they are not tech savvy. We're actually doing a program right now of a laptop and lending program where we also do a little bit of computer literacy. So we're doing that currently in Roseland. They're now predominantly in Spanish because we do serve a high number of Spanish-speaking patients. But we also receive referrals from local hospitals, medical groups, and we also take self-referrals. So it's really important if you know somebody that is struggling with a condition of chronic disease. Next. So some of the things that we do are nutrition services. We have one-on-one medical nutrition therapy. We have group classes, and we really serve a myriad of issues. So you can see a ton of different classes. All of these are evidence-based. We're recognized by the American Diabetes Association, and all of our services are in English and Spanish. So language justice is really important to who we are and what we do. Next. Just so you can see a little bit about who we serve. So 61% female, 30% 55 and older, 52% 18 to 64, and 97% of our patients are low income or very low income. So we really are the safety net of safety net. And we know that poverty is a key driver of health inequities. And so we're really looking at how do we provide this whole person care? How are we doing something that isn't just counseling or advising on what people are eating, but really that comprehensive lifestyle. Next. So we treat a myriad of things like I mentioned. One thing really interesting that we're doing too is nutrition support for those that are having hormone-based treatment or gender-affirming surgery. So really looking at how do we meet the needs of our population so that all of their needs are met. Next. So our methodology, this is Nora, one of our clinicians. She has been in community doing this for about 30 years, and she's amazing. So evidence-based, we have a rigorous quality review. We have excellent clinical outcomes, culturally responsive. I've heard a lot in community clinics kind of counseling on diet or, not necessarily having the tools to understand what is culturally appropriate for individuals. And so we're very cognizant about making sure that we are very responsive to each individual's needs. It's healing and trauma informed, rooted in science and research. And one thing that's interesting is we're constantly updating our curriculum. So it is a living and breathing thing. Nora is a great clinician. She is constantly updating the information because information changes. We also meet people where they're at. And we go back on slides. And really making sure that we're engaging individuals in a way that they can learn. We don't just talk at them, we really engage them, we invite them to share their lived experience. And there's a lot of peer-to-peer support that happens there. And it's very much continuous and compassionate whole person care. So folks will come to us and then they stay with us sometimes years, which is another reason why we keep updating our curriculum. Next. So one thing that we found is that during the pandemic, we saw just an increase of unmet social needs. People were really struggling. Again, I mentioned that poverty is one of the key drivers of health inequities. And this was really overwhelming our patient population. Our nutritionists were really trying to help focus on moving the needle in their health outcomes. But if somebody was struggling with just losing a job, losing their health insurance, really struggling to make ends meet. We had one patient, for example, that had suicidal ideations as we were on the phone with them. Because all of our staff are trained in behavioral health first aid, we were able to de-escalate through a three-way call and get them to services. So it's so important that our team is really able to respond whatever the need is. And so we were able to source funding to have integrated care coordination with our nutrition services. And this is actually a pilot that we're doing with several community clinics, including West County, to integrate community health workers into the clinical care team to really provide that whole person care. And this is really where we're linking those unmet social needs as well as the mental health. We know that there's a long wait to get into mental health, and having, as Michael was saying, the peers that have the lived experience, that have the robust training, really makes a critical difference. So we saw that in 2021, we had 740 referrals that were made and accessed, and not just a referral given. We don't just give out a number. We don't just tell somebody where to go. We really assess, are they going to be able to access it? Do they have transportation to be able to access it? We do three-way calls. We'll call back a week later to make sure that they were really able to leverage those services. And we saw 45% of those referrals were for food and 17% were for mental health. So definitely a high need there. Next. Just wanted to give a spotlight to a couple of our classes. So Steps to Wellness is a new class. They have this both in English and Spanish. And this is really rooted in behavioral change theory. And this is kind of an ongoing support for those that might have taken one of our diabetes classes or another course, but this really helps them create these action plans. And this is where we're really leveraging that peer-to-peer support. This is a drop-in class, and we have the same cohort coming again and again. We've actually had it open up. We have 2 of these classes a week. So they just keep coming back. We really are enjoying it. But you can see that we're really focusing on resiliency and coping mechanisms. And we also look at neuroscience and understanding the brain and how we really do have the power to change those pathways, change the behaviors that can help lead to the improved health outcomes. Next. Another class that we have is diabetes self-management education. This is recognized by the American Diabetes Association, both in English and Spanish. And a lot of times what we find is that folks really struggle to see the light at the end of the tunnel. No matter what their condition is, sometimes they come feeling like they failed. They come feeling like they haven't been able to implement those changes that really make a difference. And so one of the things that we really do is destigmatize where they're at, destigmatize kind of the failures that they feel that they've had in the past, and really help them feel their buoyancy and their power. So a lot of it really does focus on just helping people feel centered and grounded and in their own power to make those changes. And then we're able to really look at the mechanics of how do we implement these steps that will help lead to improved outcomes. Next. So just a couple quotes from our patients. So this is feedback from our nutrition services. One patient said, my doctor told me it was the biggest drop in hemoglobin A1C she has seen. So an improvement in hemoglobin. I learned so much. I started listening to things. I sleep better and have a lot of energy. I'm more active and happy with my diet. I love this as one of the class. The patient that lost 50 pounds. And fun fact, in 2020, we had a cohort of 20 patients that all lost over 20 pounds, and they have kept that off in 2022. So really exciting that we're helping people achieve their own goals. And then our care coordination feedback. So this is that integrated care coordination that I told you about. You're like an angel to me. Thank you for caring about me. Thank you so much for listening to me. I feel like a weight just lifted off my shoulders. You're so understanding and compassionate. Thank you for listening to me. If I could give you a hug, I would. If I did not attend the nutrition class, I would have been so isolated. I really appreciate your support. I do not know how much it helps, so thank you so much. So one thing that we've heard again and again and again is how isolated people have been. And these classes really make a difference because they do find that peer support. Right. So just a couple highlights from 2021. We had 884 unique patients, 20% of them received scholarships. And Nancy and Sonia will talk about that in a second. And then we had 755 visits. Yeah. And then our quality outcomes, so these are our median drop in hemoglobin A1C, so that was a 1.9, which is great clinical outcomes. 11 pounds in 9 weeks, and then 100% following a meal plan that they have chosen for themselves. So we do some exciting stuff, and we're really happy about it. So our process, and then I'm going to hand it over to Nancy and Sonia just to talk about insurances we take and some of the logistics so that you can tell people and share the news of who we are, what we do. So all patients are referred to the center. They're provided with a one-on-one visit with a registered dietitian. They're again linked to that care coordinator. And then based on the diagnosis and goals of the patients, they're placed in the appropriate class. And then I'll pass it off to Nancy and Sonia to talk about how to refer.
Hello, everyone. My name is Nancy, and I'm the clinical operations supervisor. And we have my name is Sonia, and I'm the operations coordinator. So when we receive the referrals, we'll get the referral. We have somebody processing them within 48 hours of receiving the referral. So the patient will actually get the call within those 48 hours. What we'll do is assess the patient. So insurance will enroll them into a class if there's a specific class. If not, what we'll do is set up an individual appointment with the registered dietitian, and from there they're able to determine if a specific class that we offer would be a better fit for them. And then if there are any medical records, we'll make sure to take care of that as well. So the patient just basically needs to worry about attending medical appointments, so it's a lot more smoother. And then we'll send an update to the provider as well once they have been seen. That way all the progress notes get sent over, and we're working together with the provider as well with communication. And then after that, the patient either continues the appointment individually or they would be into the class. And then if they do complete our classes, we actually encourage them with giving them a 3-month flyer for the YMCA pass that they're able to use. And then I believe they also get a discount after that as well.
And that 3-month YMCA pass is free.
Okay, and these are all the insurances that we're also taking. And then what we do is offer the sliding scale if their insurance doesn't cover. And this is basically our scholarship process. So we do have an eligibility guidelines that we do have to follow. So the patient will get pre-screened. Once the patient is eligible, what we'll do is send them the forms that they need. If they're not able to prevent proof of income, we'll also have another process as well. So once that gets sent back to us, we're able to have that process within 48 hours, and the patient gets scheduled right away. And that's our team.
One thing that I did want to add was about our grant. So even if the patient gets under the sliding scale, no matter if it's 25, if 50%, and or 75, no matter where they land, they'll be 100% covered free because of that grant.
So the only individuals that would not be eligible for 100% scholarship would be those that are.
Thank you so much.
Thank you so much for joining us today. So I've got a couple of questions. I know we have to be out of here at 7:30 sharp because I believe there is a dance crew coming in to use the community space. That's how we roll here. You know, and the first question that someone actually texted me gets to the point of what can family and friends do And what are resources that are available for family and friends, you know, of folks who are struggling with mental health? And I'm wondering who, I mean, I bet that everyone probably has some thoughts on this. But if anyone would like to come step up and share some possible resources and some possible ways to both support themselves and potentially offer some interventions or suggestions to their friend or family member. And more than one person can come. So if you all have a few ideas that you want to share, that would be great.
Thank you. Yeah, so I would say our peer education training class, the peer support specialist training class is open to any adult that identifies with any lived experience and with the new, there is a new level, state level certification process for peers that includes family members. And so we would encourage family members who want to learn more about this, that they're welcome to contact us, and we can provide lots of resources depending on how much you want to learn. Then the peer education training class will be available. Another thing that I would like to highlight is the work of NAMI, Sonoma County. They have phenomenal resources for families. I personally have gone through their family to family support group. It's a group that meets for, I think it's 8 or 12 weeks. I don't quite remember now, but it's folks who have family members who are experiencing mental health challenges. And they go through, it's facilitated by a family member of a peer, and they lead through and do a lot of education around what's going on for the individual to kind of help them understand, to talk to other folks, other family members who are experiencing this. It was so helpful for me, and they have lots of other resources, but that I would point folks to NAMI for family services as well.
To add to that, Buffalo Family Service Coordination is a tremendous program operated by Buffalo, and it's for navigation for families who have a loved one or you know, someone who has a significant other. They have one-to-one counseling. They have education and support groups, and they also have a resource clinic just to help and navigate any mental health services within the county. And in fact, I co-lead a family group with Buffalo Family Service Coordination once a month that we do on Zoom now. So anybody is invited to that as well.
And then just in a more of a personal sense of what can you do, get informed about what it is your loved one is going through, learn about it, be patient. Everyone's journey is different, and it never goes the pace we think it should go or we think it's going to go. Be understanding, be present and persistent. I don't promise things that I can't deliver, but I can promise that I'm going to stick with it. And so that's what we can do, is be present, be there, be as understanding and patient as we can, and then go and make use of the resources that have been shared for supports for ourselves. We are the instrument of help and service to others. And if this instrument isn't tuned, it's very difficult for me to be of service to others. So we need to do as much of our self-care as we're asking our loved ones to do.
Since I don't do this every day, I grabbed a form that we hand out to our patients too, who are looking for services. So just to add a couple more, Buffalo, obviously, SAY is a good resource for our youth. Child Parent Institute also provides services to youth 18 and under. The NAMI, I think NAMI, it's hard to, so just to say that's the word to look that up. Sonoma Family Therapy, Psych Strategies is another resource. LifeWorks. The Humanidad Therapy and Education Services would want more for our Spanish-speaking residents. Verity, VERITY, is a good resource. Central La Luz, Latino service providers are all services to kind of check out. So there are services out there, and it is somewhat difficult to navigate. So it's important to keep it.
When you're
community. Yeah.
done.
I'm done, thanks.
I'm going to remind everybody that if you are into advocacy, that you can always apply to be on the mental health board.
And if you're somebody that really wants to help community, like Michael was sharing about his amazing peer program, the Center for Wellbeing also has a community health worker program, where we have a big focus on mental health and resiliency. We learn about the social determinants of health, the systems that create inequities and challenges in our society, like structural poverty, racism, all the above. So that's another great opportunity for us. It's free. Our next one will be in Spanish in February. We'll have one in English in April.
Russian River counselors is another area that's in.
Just really briefly, I just want to go emphasize what Wendy was talking about. There's all these, what's very reassuring being here tonight is all the services that are available. I did not know that West County was so rich in resources. So this feels good, and it's really nice to hear about it. At the same time, it can be sometimes kind of intimidating to people to like call a center and do those sorts of things, but that's okay. That's really, it's like if you have someone in your family that you're worried about, or you have a loved one you're worried about, the first step is listen to your heart and talk to that person. Reach out, attend, and befriend. You know, it really makes a difference. That's why 988 is so powerful. The data from 988 and from the National Suicide Prevention call lines, we can prevent a lot of tragedies just by being there and listening and talking to people. It really does actually help. So please listen to your heart and reach out.
I think that's might be the theme of the evening, is reach out and listen to your heart. That was very beautifully stated. You know, I want to actually conclude on a personal note, sort of following in the footsteps of Scott, which is that my first encounter with the Department of Health Services and sort of our county's support for mental health challenges was not when I was elected supervisor and got a tour of all the facilities with then Director Barbie Robinson. It was actually when my little brother was on Obamacare. He's 10 years younger than me, so you know I changed to diapers and I babysat him and I put him down for naps when he was a little boy. And he couldn't get access to the mental health services that he knew he needed. He knew that his medication needed adjustment, but he couldn't actually get in to get an appointment to get his meds adjusted. He literally had to decompensate to the point that he was suicidal enough to qualify for services through the crisis stabilization unit. Which is, you know, a terrible situation to be in. And so, you know, I would just say, try not to let your family and friends fall through the cracks, because the cracks are huge. And sometimes, you know, it feels like you can't get those resources. I think that if I knew then what I know now in terms of the resources that are available outside of the traditional systems in partnerships with community-based organizations, that might not have happened. So please do avail yourself of the list of resources that are here today, because it's truly our community working together that will ensure that no one falls through the cracks. And the other advice that I would give is, again, a family member with some multiple family members who have lived experience and have been in that situation of having a friend and feeling like I was the only person responsible for keeping that person alive, you know, ended up driving the person to inpatient care, is get the help that you need from professionals, because you can love someone, you can be present for someone, and you also can't assume that responsibility yourself without getting the expert professional help that is needed. So that is kind of my personal advice and my personal moment here. But thank you all so much for attending this evening. We are lucky to have a community that cares so deeply about one another. And I think the great thing about coming together in person, having lots of folks kind of listening in remotely, is that we just get to see each other and catch up and realize all of the good work that everyone is doing. So thank you all for coming out to Monte tonight. And thank you so much, Tracy, for pulling this evening together with such wonderful partners who are dedicated to West County and really county-wide service improvement. So thank you all so much. Good night, everybody.
And I wanted to briefly share